What happens when your kneecap breaks into multiple pieces? Well, oftentimes surgery is needed to realign the joint surface and restore function. We begin by exposing the fracture and cleaning out any blood or soft tissue. The bone fragments are then manually reduced into anatomic alignment. Next, we secure the fracture using a low-profile plate and screws, carefully contouring the plate to fit the kneecap. This provides stable fixation, especially in those comminuted complex fractures. The plate allows for early motion, which helps prevent stiffness and speeds up recovery. The goal is simple: solid bone healing and full return of quad strength.